patient is in the emergency room with pneumonia and the provider orders an ABG. These are the results. Blood pH 7.20, PCO2 50, O2 saturation 87%, HCO3 or bicarb 29 milliequivalents per liter. See the patient lab results and note that the lab results give the O2 levels as PO2. This level is often similar to the oxygen saturation that is obtained at the bedside, but not always. The discussion of why this may or may not be the case is beyond the scope of this presentation. Is the pH acidic, basic, or within normal range? It is acidic. Is the PCO2 high, low, or normal? CO2 is high. Is it respiratory or metabolic? It is respiratory. pH and CO2 are moving in opposite directions, so it is a respiratory acidosis. Since the pH is abnormal, it is uncompensated even though you can see from the elevated HCO3 or bicarb level that the metabolic system is attempting to compensate. Perhaps the patient's pneumonia is causing inflammation in the lungs that is impacting gas exchange, leading to an accumulation of carbon dioxide which causes respiratory acidosis. A patient has been vomiting and having diarrhea after having contracted a foodborne illness. ABG is pH 7.59, PCO2 47, O2 saturation 98%, HCO3 or bicarb 46. Is the pH acidic, basic, or within normal range? It is basic. Is the PCO2 high, low, or normal? It is high. Is it a respiratory or metabolic? It is metabolic. Because the pH and the PCO2 are moving in the same direction, it is metabolic. The patient is likely losing significant fluid and electrolytes while vomiting, leading to metabolic alkalosis. Since the pH is not in normal range, it is uncompensated, even though you can tell from the elevated CO2 that the body is trying to compensate by slowing respirations, which increases CO2. Finally, a patient comes into the emergency room with chest pain from an anxiety attack. Labs are drawn to eliminate a more serious problem. ABG is pH 7.50, PCO2 30, oxygen saturation 92%, HCO3 23. Is the pH acidic, basic, or within normal range? It is basic. Is the PCO2 high, low, or normal? It is low. Is it respiratory or metabolic? It is respiratory. Because the pH and the PCO2 are moving in the opposite directions, it is a respiratory alkalosis. Since the pH is not in normal range, it is uncompensated, even though you can tell that the body is trying to compensate since the bicarb is on the low end of normal. PO2 is also a little low, indicating something of a more respiratory nature. This patient is hyperventilating, leading to the decrease in CO2 and respiratory alkalosis.